Ready? Good afternoon, everyone. This is County Executive Pat Ryan. Thank you for joining us. I hope you're doing well. I am here to give you the usual, I guess what's become the usual updates on COVID and other key things happening in Ulster County. Today we're going to primarily talk about the public health situation with COVID, and then also a little bit about some of the work we have been doing and are especially ramping up around opioid prevention this week and in the coming weeks and months. But to start, as usual, we'll start with the data. Looking at the overall numbers and the overall situation in Ulster County, we continue to be in a very good place and in a pretty stable place at this point. You can see just over 2,000 total cases since the beginning of the pandemic out of over 76,000 tests now completed. Thankfully, almost 2,000 residents recovered, 1979, and fortunately, we are holding steady and have not had any additional fatalities since our last update, and we hope, of course, that that continues. In terms of hospitalizations, we have added one more hospitalization since the update last week, so we're at 2 total individuals hospitalized in Ulster County for COVID. One of them, the same individual, remains on a ventilator in the ICU, unfortunately, but still hanging on and fighting. And we know that we have seen many fight for weeks in many cases and even months in a few cases. So we continue to send our love and our best wishes to them to make it through this, as well as the other individual hospitalized here in the county. We are holding pretty steady on our active cases numbers. We are at 112 today, and this, as you can see on the graph, has pretty much fluctuated right around that level now for several months, and we're working to continue to hold it at this level. Most important metric for tracking how we're doing with we're well into reopening now, but really how we're doing with managing any new infections in the midst of the ongoing pandemic. You can see on the graph that we are holding really at the same level that we've been at most of August, and now I guess today is it September 1st or 2nd? Let's see, what day is it? Yeah, it's September 1st. Happy September. So we're holding steady below 1% on the number of new positive cases day over day. To give you a snapshot or 2 snapshots, over the last 72 hours, we have tested 2213 residents and had only 12 new positive cases. So that is a 0.54% new infection rate, which we're pleased with and hope continues. In the last 24 hours, even better, we've tested 538 individuals and had only 1 new positive case from among those. So we continue to hold on here. As I say often, this is not by accident. It's thanks to everyone doing the difficult things that we've asked in terms of masks and distancing and hand washing. So we know, as I say every time, that we need to continue that to stay where we are. In terms of hospital capacity looking out forward, we remain in good shape there. You can see more than adequate capacity for the near, medium, and long term between our hospitals in the county. Before we transition to talking about the opioid epidemic and some of the progress we've made on that front, just one more reminder, as I always do, and as I just sort of alluded to, and the progress that we've made, the place that we're in to be right around a 0.5% new infection rate when we know so many other places are really struggling with COVID. I'm proud of that. I'm thankful to each of you for that. And as a reminder, the way that we can keep that going is, again, the big 3. Wear masks, maintain the social distancing, and wash hands. We've seen now for months that this works, and that as annoying as it can be and inconvenient and frustrating sometimes, that it works. So let's keep that up, and thank you for everyone that is doing their part. I do want to talk a little bit, and I was at a press conference this morning about this, and also made some announcements yesterday, but to everybody tuned in, I want to shift gears a little bit and talk about something equally urgent and important and really tragic and deadly in many cases happening here in our county. So we know we've been in the midst of a unforeseen and once in a century COVID-19 pandemic, but that has also intersected with a long-standing epidemic of a different kind, which is the scourge of opioids and substance use disorder that plagues our county. And I think it's very important. I've said this before, but I think it bears repeating. In the midst of COVID, we cannot lose sight. We must not lose sight of the opioid epidemic as well, and how many folks are struggling, and the work that we have to do on that front. Unfortunately, and I'll talk about the numbers in a second, we have seen the numbers of overdoses and fatal overdoses go up this year, largely, we believe, compounded by COVID, but also as a result of many previously existing challenges that we've talked about before. In light of that, yesterday, along with sitting with our district attorney and our undersheriff, for the first time, at least to my knowledge, in Ulster County, I went ahead and declared a public health emergency specific not only to opioids, but actually to fentanyl. And I'll talk a little bit more about why we are so focused, and why I've had the whole team focus on fentanyl specifically. But part of our goal here is really to make sure that everyone in the public, all 180,000 residents of the county, are aware of the seriousness and of the threat of fentanyl and the impact that it's having in our community. So on this next slide, you'll see a graph. I know that the numbers are probably a little bit small to you watching on your phones or even your computers. The big takeaway here is that over the last really year, but even going back a little bit to 2019, we have seen a huge increase in the number and the percentage of fatalities caused specifically by fentanyl, which is a much more deadly form of opiate. And in 2020 in particular, we've seen a compounding effect where we're only through July, and we've already had more fatalities in Ulster County from all opiates through the half of the year than we had in all of 2019, which you can see on that chart there. And this year in particular, 89%, so 34 of the 38 fatalities, are definitively linked to fentanyl. It is extremely dangerous and deadly. And we know that this really is the main culprit in why we've seen both overall overdoses, but specifically fatal overdoses, go up. A little bit more on that to sort of put it in writing here on the next slide. From January through July of this year, 2020, we've seen an almost doubling of the overall overdoses and fatal overdoses in particular, to be exact, 171%. And again, as I mentioned, in 2018, fentanyl was only accounting for 58% of the deaths, and this year it's been 89% of the deaths. And here's why. The most important piece, which I know is slightly cut off at the bottom, my apologies. Fentanyl is 50 times, 50 more times more potent than quote-unquote normal or traditional heroin, and it's 100 times more potent than morphine. So understanding the lethality of this drug is very, very important for everyone to recognize, and also makes it much more important that we interrupt the flows of these drugs, that we educate our young people and our entire community about the dangers, and that we work with everyone that's in recovery or working towards recovery to make sure that they don't slip backwards. This morning, on this front, as a follow-up to the declaration of public health emergency, I was very proud to stand with our sheriff, with our district attorney, and with the leadership of Urgent, which is our county-wide task force focused on narcotics, to announce the single largest drug seizure in the history of the Urgent Task Force. Thanks to the great work of Sheriff Figueroa's team and really the Urgent Task Force in particular, 10,000 bags, 10,000 already dosed out and ready to sell bags of heroin and fentanyl were intercepted right here in Ulster County. And when we think about the fact that that was, a regular volume of this drug that is flowing in, and thanks to the great work of the team, they intercepted it. But we know that gives us a sense of the sheer scale of the problem and the volume of this deadly substance that is pouring into our county, and we know that it's largely coming from the south of us. This is a really important immediate step because those 10,000 doses are now off the streets, and that means definitively that lives were saved thanks to this action. I really want to give credit to the law enforcement, different law enforcement agencies, and particularly to Urgent and to Sheriff Figueroa for their work on this. It's a really important step, and also clearly shows that we have a lot more work to do, which I know they are committed to doing. So to see the teamwork here, not just of law enforcement, but to bring the entire public health apparatus that we have to work on not just interdiction, but prevention and on treatment. I want the residents of the county to know that, again, even in the midst of COVID, we understand the challenge and are absolutely focused on doing everything that we possibly can to prevent the absolute tragic deaths that we're seeing from opiates in the county. Clearly, we have more work to do, and we are making those adjustments. We are adding more resources, and I am adding more emphasis to the urgency of this. And to all those out there right now that are peddling these drugs, knowing clearly the lethality of what they're dealing, I think this morning's announcement sends a very clear message that we have zero tolerance for this in our county, and we are going to continue to make sure that this does not happen and perpetuate and ultimately cost lives and really destroy and shatter families throughout our county. So again, thank you to everyone involved in that, and I know more work to come on that front. Shifting gears a little bit from that topic, I do want to make one other request and really make you all aware of something, another opportunity to get involved in what's coming up related to elections in our county. Many of you know this, but some may not. Our entire election process is powered by a cadre of poll workers who are residents of our county who every year sign up to do this very important work of running our elections and making sure that they go smoothly and safely and that they're conducted in a fair and transparent manner. Many of our poll workers, just by circumstance, are seniors. In fact, 55% of poll workers across New York State are over the age of 60. So given the public health risk of COVID to everyone, and in particular the public health risk to our seniors from COVID, we are facing a potential shortage of poll workers this year at a time when we all know how important our elections are, and we need to make sure that they're run smoothly and fairly. So this is really a critical need for us, and I just wanted to put out a call. In fact, today is poll worker recruitment day across the state. If you are interested in doing this very important work, in this case, it's an important service, but it also is paid work. So you would be paid and compensated for attending the training to become a poll worker. You'd be paid for every day that you work. And because we have early elections starting October 24th, there's the opportunity to work on the polls for several days, or actually several weeks, leading up to the ultimate election day in early November. So if anyone is interested in that, or you know someone who might be, the easiest way to sign up, which is also the link to all of our information on how elections are going to work, you can go to voteulster.com. voteulster.com. That's the single place where you can sign up to be a poll worker. You can learn more about what we talked about last week, which is how to vote by mail, how to vote at our 5 early voting sites, and of course, how to make sure you're set up to vote on November 3rd if that's when you choose to do it. So you have 3 options. All of that information is at voteulster.com. Those are the main updates for everyone. I appreciate you tuning in. I appreciate all the work that each of us are doing on an individual basis as members of teams and businesses and organizations, not only to keep us healthy and do those public health things of masks and distancing and hand washing, but just the work that everybody's doing to try in a very, very difficult, very high pressure time to just keep us together, to keep a sense of community, which I know we have, which I know has gotten us to this point. And we've seen it in things like our Project Resilience. We've seen it in things like so many volunteers stepping up across the board to help those in need. I especially want to thank all of our frontline workers that have been putting themselves out there and putting them and in some cases their family at risk for months now. Our healthcare workers, our grocery store, public transit workers, our teachers who I know have many, many pressures on them right now, our pharmacy workers, law enforcement, mail carriers and delivery, journalists, first responders, and really everyone else, again, that has put themselves out there. Let's not forget what they've done for us and what each of us have done to get us through. I really am proud of Ulster County, and I think we're a model, not just for sort of how to do this from a scientific data perspective, but just the heart and the compassion and the sense of community that we've brought to this. So thank you, everybody, and let's keep that going forth. Our next update will be on Thursday at 2 p.m. In the meantime, or anytime, if you have any needs related to COVID or any of the other critical recovery services, you can reach out to us at the Recovery Service Center. We'll put that information up as we close today's broadcast. I forgot. That's right. We have the cool new graphic. So that's the information right there, 845-443-8888. You can see the website as well. We are standing by to help in whatever way we can, and we get dozens of calls a day at that number. So don't hesitate to reach out if you have questions or have need. Thank you, Radio Kingston. Thank you, Roxanne. It's nice to have you back today, and Manuel. So we will see you all on Thursday. In the meantime, be safe and healthy and resilient, and take care.